Join us for the first episode of our two-part course on becoming a risk adjustment coder and HCC specialist. Hierarchical condition categories are codes for chronic diagnoses a patient may have. Along with demographic data, they show a patient's health complexity and resource use, offering a clear view of their overall health. This series will get you ready to use this knowledge in coding and succeed in the CRC exam. Risk adjustment is important for healthcare organizations because it influences payments in many value-based systems like Medicare Advantage, Medicaid, or ACO REACH. Check out our other videos to learn more about value-based care arrangements. Capturing chronic conditions accurately impacts revenue, care planning, and health priorities. If documentation is poor or codes are missing, it affects revenue, misrepresents patient needs, and disrupts resource use. It also risks compliance due to coding mistakes. So, what will you learn in this course? There are 4 foundations. Clinical documentation literacy. You must learn to read a chart like a clinician and know which phrases support chronic conditions, exacerbations, and status changes. The ability to distinguish history of versus active disease and spot evidence that a condition is being monitored or treated is key. ICD-10 mastery. Beyond memorizing codes, know conventions, laterality, and code specificity. ICD-10 is unforgiving. Unspecified codes often won't map to HCCs or will lower RAF impact. HCC logic and risk models. Understand how diagnoses map to HCC groups and how risk adjustment factor scores are aggregated. Learn the difference between hierarchical rules, exclusions, and how multiple conditions interact. Query and compliance skill set. When documentation is incomplete, you must write concise, compliant provider queries that get clear confirmation without coaching the clinician. A quick real-world example to anchor this, imagine a chart with repeated notes about shortness of breath, diuretic prescriptions, and an echo showing reduced ejection fraction. That bundle of evidence supports a chronic heart failure diagnosis. You need explicit problem list documentation or provider confirmation to code it as an HCC. Spotting those signals is what separates a basic coder from an SME. As a coder, you'll generally follow this workflow to convert clinical records into accurate HCC capture. Step 1. Spot potential conditions. Look through problem lists, provider notes, medication lists, specialty consults, and lab or imaging results for chronic condition patterns and specific language. Phrases like is being treated for, history of, and stable affect coding differently. Step 2. Find the supporting documentation. Remember that mentioning a symptom isn't enough. You need evidence of active management or clinical findings. For diabetes, look for notes like type 2 diabetes with neuropathy or treatment evidence for neuropathic pain, monofilament testing, or foot exam results. For COPD, check for spirometry, home oxygen prescriptions, or pulmonary consult notes. Step 3. Having found the documentation, choose the most specific ICD-10 code. This means considering laterality, complications, sequelae, all details from the provider. Vague or unspecified codes might not map well to an HCC or could lead to missing parts of the RAF value. Selecting the specific code is only part of the task. You must also see how it works within the HCC model. Many conditions are hierarchical and can override each other. For instance, diabetes with complication replaces diabetes without complication, and some HCCs negate each other. After picking your ICD-10, use your HCC grouper. This ensures you've captured the highest weight HCC, avoided exclusions, and kept your coding compliant. Specificity and hierarchy make your work accurate, defensible, and valuable. Step 4. Validate and query when necessary. If the condition's active status isn't clear, write a concise, non-leading query. For instance, documentation shows chronic diuretic therapy and previous cardiology notes mention reduced ejection fraction. Please confirm if the patient has chronic systolic heart failure needing treatment. Keep it compliant, avoid checkbox answers, and suggested wording. We will explore queries in more detail in our next video. Let's review 2 short vignettes for practice. In Vignette A, a patient has repeated prescriptions for inhaled corticosteroid/long-acting beta agonist, rescue inhaler fills, and a pulmonology note stating COPD chronic and treated. That's solid. Code the COPD and map to the HCC. For the next example, a patient has intermittent dizziness listed as history of vertigo. No current meds or specialist follow-up. That's likely not HCC worthy unless the provider documents active vestibular disease or treatment. In this episode, we've covered why risk adjustment coding matters, standard HCC workflows, and core skills to focus on. In the next episode, we'll jump into documentation improvement, compliant querying, and focused CRC exam prep with practical examples and walkthroughs. If you're serious about becoming a CRC-ready risk adjustment coder, hit subscribe on WealthCare.